Hi, it's Matt Kendall here today, and I'm joined by Sonia Richards. Sonia is a fellow IEMT trainer. She's also the international chair of the Association of IEMT. Put my teeth in. Sonia, I've actually done an interview with Sonia before as well. I'll link to that below, and that's all about her experiences as a practitioner and a trainer. But what we're talking about today is the advanced IEMT course. Now, I've been through the advanced course, and in theory, if I wanted, I could actually teach the course, and I haven't done so as of yet. I have a lot of questions about it myself. A lot of people put questions in as well, basically asking, what is it? Because there are two separate courses, the practitioner course and then the advanced course, and then nothing else. So today we're just going to go through basically what the advanced course is, what's it made up of, should you take it? So Sonia, so to take it away, what, as a brief overview, just like as a
brief
headline,
overview.
as a brief overview, what's the difference between the practitioner course and the advanced course? What would allow the practitioner to do which they can't already do?
Well, it's a bit like that question, what's the difference between IEMT and EMDR, isn't it? We could go down that one forever. Yeah. However, of course, there is differences. And the reason Andy developed a further course was because what we realize is that not everybody has single emotions that are just, one specific problem that can be swished away with a bit of eye movement, and that's it, they're out the door. Of course, as human beings, we are a lot more complex than that. And emotions aren't ever in isolation.
Yeah.
And so sometimes we've all had them, if we've been doing IEMT long enough, those clients where we just can't seem to get to the bottom of, they'll come in and say it's one thing, but we can't seem to get a handle on what it is to work with specifically. So what this course does is give you extra depth, if you like, and extra tools to work a little bit more specifically with people in a more sort of fractionated way. Okay. So we can break things down a little bit more. Yeah. And there's lots of processes within the training, not only for the kinesthetic side, but also for the identity side as well. So as I say, we can bring a little bit more depth and ask a few slightly different worded questions as well that can sometimes be the difference that person needs to hear.
If people don't know what kinesthetic is, that's basically just feelings, essentially, feelings or emotions. Because in the practitioner course in IEMT, there's two different types of eye movements. You have the straight line or the infinity or the lazy 8. Essentially, the straight line is used on the kinesthetics, which is basically a standalone memory, which is the simple pattern, or the complex or the integrative pattern, which is to do with imprints of those memories. So you're taking because IEMT doesn't work on emotion, it works on imprints, and the identity work, which we won't really get into because it's quite hard to explain, kind of go through, but basically that's ways of being as opposed to ways of feeling. So kinesthetic just means feelings or emotions or state. It's all the same thing.
And really, as Andy and I have discussed this an awful lot about identity, because that is the area that I am actually more interested in, I have to say. It is the area that I love. Also, I do is metaphors of movement work, which came from IEMT, and it came from the identity model.
Yes.
And really, when we are seeing people with all of these different issues, I come back to the 5 patterns of chronicity. And if we think about the person who is, at effect rather than cause, well, a lot of people come in to see us at effect. And it can sometimes be simple to deal with the effect, and they're going to be happy and walk out the door. And that's it. But in a lot of cases, it's not really how, the effect of how they're being, it's the who they are in the first place that causes how they're being. So the who they are is something that we really want to start to work with. And not only who they are, but then who they are with other people. So what this course does is it actually looks at our connections with other people, and then can start to work out the transactions that people do with each other that can cause problems. So we we expand the work out to look at more relational things as well.
Excellent. You know, just talking about the effect and cause, somebody said it was really interesting the other day to me. But being effect and cause, and the identity, treating somebody for the effect is like treating a hangover.
Yeah.
The being is the person who does the drinking. So you've got to address that person, because you can treat somebody for negative feelings and memories, but if you don't change who they are, they're just going to go and do it again.
Exactly. And that's it, you know, this work in a nutshell. I'd say, as you know, Matt, so many people will go away and think IEMT is that.
Yeah.
And it's about just bringing a kinesthetic down from 10 to whatever. And, you know, and someone feels a little bit better and they go out the door. But if we are not challenging their patterns of chronicity, their emotional cycling that they will be doing, as a lot of people will, and who they are, then I don't think we're doing a full work, you know, amount of work for that person, and we're kind of shortchanging them. And, you know, we may as well just do a bit tapping or swish it away or whatever it is, you know.
Or build up that
IEMT is cleverer than that. You know, it is. And with the advanced course, as I say, what we can then do is start to break things down to get more specific. So we have, so for the feeling kinesthetic work, sometimes the problem that the person has, which they think is their feeling, is actually not. They are responding to somebody else's perspective of an issue. So if there was a trauma, it has a ripple effect out into the family and friends, and how they may be reacting, maybe because of someone else's experience of their experience at the time. And it sounds like it gets a little bit complex, and it kind of can, but we have fun with it as well. So what I do with people is, if I'm getting them to work with perceptual positions, is it my position that I'm reacting from? Is it my thoughts about somebody else's reaction? I get them to actually move around.
Yes.
Stand up and move as well, which is, you know, really, really good for them to do.
Because perceptual positions is a very sort of NLP kind of thing, isn't it? Sort of physically moving to change the trauma. I see that you've got the schedule there behind you.
That's part of my schedule. So that's sort of my up until lunchtime on day one.
Oh wow, okay, so there's quite a lot sort of going on. So,
I mean, I have actually got a sort of an overview of the schedule, which I can put up on the screen if you want me to.
Oh, that'd be great, actually.
People can have a quick
it's just because it's like I say, it's a 2-day course. So it'd be really interesting to know actually what's sort of in there, what people now. Just before we get into that, can I just say, everyone asks me, should they do the advanced course and when they should do it? And I'd like to get your perspective on this. I say, I think you should do it if you want to go deeper into IEMT. However, I wouldn't do it until you're very good at IEMT and very experienced, because I know people who are sort of master practitioners at NLP and I've never worked with a client, you know, they just go on courses. And so I think to do the advanced course, I would say at least work with 50 people. So you've got a lot of experience using IEMT, the patterns, and so you've got a real good understanding, because I personally think the more you bring to the advanced course, the more experience you bring to it, the more you kind of take away. Because I know when people do my practitioner, the more research and the more reading of the materials I send them in advance, the more they will get out of doing a practitioner. And so I definitely think because when you do an IEMT course, it's completely different to any other kind of training that
it is a
completely
completely different, you know. And I always ask people to come, I call it the discovery frame.
Right.
And it is coming, you know, to discover something new. And to hold off on their judgments and everything else they've learned before, and come at it if they can with a fresh mind and fresh eyes, because it is so different. I ordinarily would say what I used to say is I would like people to have at least 6 months experience of the practitioner course. Some people leave it even longer. They'll do it after a year or two. However, other people teach it differently. and other people will do a practitioner and advanced practitioner literally over 4 days.
Yeah.
So, you know, so the way I look at it is this: if a person is very, very motivated, then I still think they can get an awful lot out of the practitioner, even if they do it within a couple of months. In fact, I have a lady who I trained, she's my first lady from Latvia.
Oh, okay.
And she trained last year, last November, but she is so good and so dedicated. And by the way, came to IEMT because she had PTSD that was dealt with IEMT.
Great.
And that's how she came to it. That she asked me, can I do your practitioner? I've got one coming up in March. And I said, actually, yes, you can, because I know she's got the right mindset to, and she really wants to go deeper with this work and work with trauma. And one of the things that I also do on the course is look at all of the models that Andy has set up, like the 3 pillars, like the PTSD model, but go slightly deeper as well and expand the uses of those models, because they are so useful in other respects as well. So rather than just looking at it with a frame of reference, if we can extrapolate that out, then we can certainly be just working on so many different levels for people, but also we get a little bit provocative, or I get people a little bit out of their comfort zone as well, because again, you know, one of my mantras is our emotional state needs to be stronger than the client's problem.
Yeah, of course.
So therefore, what I tend to do with the very first exercise is get people out of their comfort zone by doing an exercise with them. That's kind of going to test that a little bit. But also it just demonstrates again that sometimes, you know, as therapists, a lot of people come as hypnotherapists and counsellors, and they've been taught to be very nice and touchy-feely.
Yeah.
As Andy always says, you know, we don't always need that. In fact, sometimes that can be a disadvantage when we're in the field of change work as opposed to care and support. And so sometimes we just need to shake the box a little bit for people, don't we?
I do get I get a lot of people who think everything should be positive. So they've come from like the NLP coaching perspective. And I kind of say that IEMT is a bit sort of like going to the dentist. If you went to the dentist and you've got a painful tooth and they're kind of going around, oh, that hurts. Well, okay, we'll move past that then. Well, nobody's going to benefit from that. Doing IEMT can be unpleasant because you're going into some, you know, but it's, again, I'm not creating the pain, I'm relieving it, as the old massage said, you know.
It definitely is that. You know, as that great film by a famous rabbi, I can't even remember his name, that talks about, you know, a lobster, and when a lobster needs to grow, it needs to actually get to a stage where it's really uncomfortable before it can shed its skin.
Of course. No, I completely agree. And I think that, with IEMT, it is sort of a challenging, but what's also really good as well, from a client perspective, you're not necessarily going to talk about the issue because it's pretty much content free. So let's say that you've been sexually assaulted, for example. If you go for standard counseling therapy, you're probably going to talk about the assault and how it's affected you and everything like that. With IEMT, you'll probably do like a PTSD model. You kind of go after the linchpin of what the thing is without talking about what he did or you did, and then just mop up the memories and the feelings and the identities around it, as opposed to talking about it.
Interestingly, you bring that up because sometimes, again, we do know, even with that amazing model, which it is, sometimes we can't quite get to the linchpin for people, or they're avoiding the linchpin, or they're coming at it from a different perspective. And this is where the advanced work comes in.
Okay.
Then we can dig a little bit, look a little bit more specific, say at those perceptual positions that they're at. We can be a little bit more provocative, perhaps. And then we can get them to an aha moment of, oh yeah, it's that's the thing that it is.
Okay. Yeah, absolutely. No, I completely agree. And I think that knowing that, sorry, there's some sort of alarm going off. where I live. It's really
Hear it,
fun.
you're right.
Yeah, because it's got sort of noise suppression on this, like, but no, yeah, so you shouldn't be able to hear it, but all fun. Yeah, knowing the reason why you are the way you are is sort of like half the battle.
Yeah,
And they talk
absolutely.
about in therapy, you know, you might have a breakthrough after 6 months. With IMT, it tends to be, you know, in the first session that you get ready. Anyway, I'm coming to your advanced course, should we say?
Yeah.
What to expect? You say we have a schedule, we have the actual
I
thing.
have
So
a schedule. I'm just going to lean over and change my full button, and hopefully,
oh wow, look at
so
that.
you can see
Excellent.
that. So let me just bring that up for you. So this is just the schedule. This is a very brief outline. Obviously, this is divided up even more, but we start off with what we call zero-sum game.
Yeah.
So that's the system thinking, because this is what really the client therapist transaction is all about.
Yeah.
And learning to understand why people with zero-sum game thinking can have problems forever, even if they go and have a therapy. If they continue with the same mindset, then they're going to get the same problem back again. So we look at working with that. Then we do the little bit of provocative questioning that I was just telling you about, which, as I say, can get people feeling quite uncomfortable, but some people absolutely love it. And I'm one of those people that
Is
love
that
it.
coming from any of Frank Farrelly's work at all?
A little bit, yeah. So it's based on Nick Kemp's.
Nick Kemp, yeah.
But it's very, very, only a very small vignette of that. It's a little nod to Nick. But again, all done, you know, very conversationally, very light actually as well. So provocative work shouldn't be, you know, heavy. It should also sort of be done with a very lightheartedness in effect. But what we're doing is getting people to, again, stop their train of thought and think slightly differently.
Yeah.
So that's that. Then I go into, as I say, looking at the 5 patterns again, just to refresh it for people. It's one of those things that people often forget. They go away and they never even think about the 5 patterns of chronicity. You know, every client that comes in, you absolutely should be listening out for those patterns, because unless they are challenged, they're just going to go away and do it again. So I go into that a little bit more deeply. And then likewise, the 3 pillars.
Yes.
So go into the rule structures a little bit more with that. So sort of tie all of that in. And again, other uses for the PTSD model, which are, you know, as I say, I tend to live my life by that model, but not because I have PTSD, but because it's so useful for other things.
Yes.
So, so that's one of the things to do. And then we have that advanced questioning. You know, there's about 15 or 16 questions. We can divide them up into different positions and then work through them. Now, I'm not necessarily going to do all of that with a client, by the way.
Yeah.
I may just choose 1 or 2 that are relevant in that scenario. But we do it in the course because, again, we want practitioners to push themselves a little bit.
Of course. Yeah.
And really start to, you know, experience things slightly differently. And also, if something comes up for them, then of course they've got the tools and the skills with eye movements to work on it in the session. So that's what we do. We kind of push things a little bit. Also, I can see people's patterns of chronicity, of course, emerging, which I certainly will be challenging and talking about, because equally, as practitioners, if we don't work on our own stuff, really, how can we be expected to be working with other people?
Absolutely.
So constantly, as a constant, as an IMT practitioner, we should be working on our own stuff.
Well, you shouldn't see a fat personal trainer, you know, in that
well,
sense.
yeah, exactly. Yeah. But I mean, no, but I mean more sort of, you know, our emotional. If I'm a great big what-ifer and I'm a maybe person and I'm always at effect and I don't deal with that myself, I'm unlikely to be able to spot that in other person, other people that coming in to see me if I can't spot it in myself. So it's really important that people, you know, are able to do that for themselves. So it's, you know, and then I start looking at things like working with phobias and working with pain. So just changing the protocols a little bit and the wording a little bit to get a little bit more specific in those areas. And I've also added in, because one of the areas that I do quite a bit of work with We have a mental health unit here where I am, but I sort of get people referred to me with eating disorders that they can't seem to do anything with.
Okay.
And so that's one of the areas that I'm interested in. So I just give some ways of thinking about eating disorders, and I always say that actually most eating disorders are identity based. So yes, we can help people with what they're feeling, but we need to get to the core of the who I am.
And eating disorders is a very interesting one, because with like smoking, drinking, drugs, what have you, it tends to be a peer issue. And also you can stop that. You can not drink, you cannot smoke. The
But
thing is with eating, you've got to eat. Yeah. Exactly, so that's the so I don't do personally, I because I think that's quite a specialist thing to do with eating.
It is quite specialist, but people will come to general IEMT practitioners with weight issues and stuff like that. So even just understanding, listening to the language and being able to pick up on stuff is really important. And then day 2, we tend to start off with dreams and sleep issues. So again, that kind of feeds into depression, because of course what we know is people with depression often have very poor patterns of sleep. They often overdream. So we look at the cycles of sleep and dream. And again, also how we can work with things like nightmares. So how we can use IEMT for nightmares. Great for children, absolutely brilliant for parents, So using this, if a practitioner has their own children and wants to be able to use some of this stuff, they absolutely can. Then I throw in a little bit of fun. So again, I'm interested in personality of a person, because who they are often ties in with their personality. So I do something called DISC profiling. So I just touch on that, and we just do it as a bit of fun for people to get a little bit more understanding of, again, who they are and how they are operating in the world themselves as practitioners. So what areas they may need to just change a little bit for themselves. So we do that. Again, we look at anthropomorphic states as well. So the person, taking on board an identity of, for example, a disease, and making that some sort of entity. So how we can look at that and again, listen out for it, work with it a little bit more. Then we look at those pronounscapes again. So we go into the I, me, self, and you, just refresh that for people. Looking at their identity, wants and needs. I used to do this on the practitioner, but actually there's so much on the practitioner that there's just too much, So again, what the person wants and what they need are often slightly different. Again, when I'm working with people with eating issues, their wants and needs can be vastly different. So just changing the questioning a little bit, both on a kinesthetic and an identity level, that can just help to give us as practitioners a better understanding of the person. And then we do that connection work. So, how I relate to you, Matt, how you relate to me, all of this sort of thing, and why that again, because, how I relate to you might not be the same way as you want to relate to me. And so people in a relationship, one person might really want to connect in a loving way with that other person, and that other person may want to just connect in a sort of a social way. And all of these issues can then cause lots and lots of problems for people. So again, we do a little exercise. We look at a person that they don't connect with very well. And it's a bit gestalt, obviously, because the person isn't in the room and you're not working with them in reality. But we kind of assess how we think we connect, how they connect with us, how we want to connect with them, things that we can then do to change. And again, if big emotions or issues come up, guess what? We've got IEMT to deal with stuff. So all through this training, all through the process, I'm saying to people, look, you're practitioners now. If a big emotion comes up and you're working with someone, guess what? Deal with it together. This is what you've got those skills for. So really important with that. Then I think the exercise that I enjoy the most, and most people do, are the family panoramas. And this is the exercise that we do with coins.
I was going to say with the coins.
Based on Lucas Dirks' work. It's a bit family constellation-ish, but it is excellent. And what I've done with this over the years, and I'll just bring this back onto me now, me, it's all about me, is I overlay some of Andy's metaphors of movement into that exercise as well, because he's got this compass of positions
Yes.
that can be overlaid onto the positions of the coins, and it absolutely works brilliantly. So I've kind of melded the two.
Oh, cool. So
just like a little introduction then, and all through the training, I must admit, I am giving little examples as far as somebody's metaphor is concerned, because even if you don't do metaphors of movement per se, if you can hear the metaphorical statements and you understand what category of metaphor that is, again, even if that's all you know, it can be fantastic. So what I also do for everyone that does the advanced training is run an extra little training for them on an introduction to metaphors of movement, so they can come along and just learn a little bit of that and overlay some of that into their work if they want to.
yeah.
So they get that as an extra bonus, really.
Cool.
So,
Cool.
yeah, so it's an awful lot. We get through an awful lot in 2 days, but I personally think it's worth it, because you know, that's the way I prefer to work. Now, I know not everybody's going to want to work in a deeper way, and they are working there, maybe people that do tapping and that kind of thing, or NLP, and they're not going to kind of want to work in this way. They're not going to want to work with people with depression and suicide and PTSD and eating disorders, and that's absolutely fine.
And this is why I think it's so important to, when you come to do the advanced course, is to have a real good understanding, knowledge and experience with the practice, because there's so much in the practitioner. That's why I've never taught the advanced course, because that's a whole other, as we've been through, it's a whole other lot of stuff. And I love the practitioner course. I love the tools. And
I mean, as far as a standalone modality is concerned, I mean, and I've done it all, Matt, you know, over the years, been in this game for over 20 years. And when I came to Andy's meeting all of those years ago in a foggy Brighton town, it was like my aha moment. It was, this is that piece of the puzzle that was missing. And as a standalone modality, I think it is the best one out of everything. So, and as you say, if a person uses all of the skills that we teach on the practitioner correctly, you know, depending on what we're working with, we may never need to go and expand out, but there's always going to be exceptions. There are always going to be exceptions, and we cannot legislate for the human being that's going to come to see us and their complexity of problems.
Yeah, of course.
So, but the practitioner is fantastic course.
And so by attending the advanced course, you know, you're going to go deeper into the, well, everything, I suppose.
Yeah.
You know, you also go deeper into
it's
everything.
a lot more self-reflective, you know, the exercises that we do, you know, I'd say I'm challenging people to you know, work with their own stuff as well if they want to. They don't have to, like all things in IEMT, you don't have to actually invest an emotion in it. You can just do the learning, and that's absolutely fine. So I'd never force anybody into that, but most people enjoy, especially with the coins exercise, you know, it's very, very personal, and the amount of concentration sometimes on where those coins are going to go and who they represent and all of that, you know, is mind-boggling and fascinating at the same time, really.
Just if people are wondering what we're talking about with the coins, essentially what you do on a table, you have different values of coins. So it could be like, well, from a £2 to a 1 pence, isn't it? If you're doing, you know, British coins
and foreign coins. I have a big pot of all denominations of all countries as well.
And what you do is you literally map out your family in relationships, and you can do it with work relationships and stuff as well.
All sorts of relationships.
And it's just like the physical manifestation of the.
It is like a physical manifestation.
Yeah, it is.
People really seem to engage themselves somatically. Oh, and that's the other thing I'm actually doing on this course as well. Well, I'm actually bringing in some somatic questioning and working with, because we don't tend to do that so much on the practitioner, although some people will do generally anyway, but we bring that somatic connection in. So this is that exercise that Matt's describing is very much a somatic exercise where the person really feels that connection. And as Lucas Dirk says, basically, we are always at the center of our own universe. Okay, and this is how autogenic metaphor works as well. And everybody has a place, and there's a place for everybody in comparison to where we stand.
Yes.
And so we map it out, and then us naughty trainers, what do we go and do? We go and change it on them, don't we? So what we do is we start messing about with their coins and moving things around and seeing, is that comfortable? Is it less comfortable? And challenging those positions, because again, we can get stuck in those positions. And if we are having trouble in a relationship, we're feeling stuck, whether it's with a parent, with a child, or whatever it is, by just changing these coins, again, can make such a huge difference for people.
It's quite interesting. I did like a little version of this with a guy who was having problems at work. And so what we did, we just got some objects literally on a table who represented the people who he worked with. And what happens is when you move the pieces either further away or closer, it will bring up, it will elicit feelings, identities, and problems. And what was really interesting is that if you moved him away from the boss, he felt vulnerable. And if you moved him towards somebody else, he felt exposed. And then what we do as IEMT is, when these feelings are then elicited,
then we do the eye movement work.
Then you do the eye movement work on what's being elicited.
Absolutely.
So it's just fascinating stuff. So this is why you need to know, if you don't know how to do that eye movement work first, there's no point doing the advanced stuff.
No, absolutely right. Absolutely right.
So it's a 2-day course and you're running them online.
I am, yes.
I'll put the links below to your sites, and there's a training schedule on the association, and there's lots of information in your blog. I'll put all those links below. You do need to be a practitioner to come onto the advanced practitioner, if that's correct.
It is. However, I've had somebody ask me who's training in the practitioner, who really desperately also wants to do it, but they're from another country, many, many miles away. And I have made an exception this time, because Andy has done that in the past. He'll go to India and he'll do the 4 days in a row. I've had a good think about it. I've looked at what other skills they have. They are a therapeutic practitioner of other things. So they have a background understanding of things like depression and PTSD, all of these things. So, if people really desperate want to do it, just speak to me, and if I think it's appropriate, then absolutely, we can have them on the course. So
fabulous. Well, thank you so much for your time today. It's been really good to go through the actual structure of the practitioner, some of the different tools that you get taught, and how you kind of go through things. So
the other thing is, with online, of course, everything gets recorded, but they get a specific recording just for their course, so no one else can access it. It's very safe. So, everything we do on the course stays on the course, and they have access just to those videos, but they get a whole raft of pre-course materials, post-course materials, videos that I've done with Andy exclusively just for the practitioner trainings as well. So, that's all available.
Yeah, because I have the audio recordings of when I did the advanced. I wish I had the videos, because audio is okay, but it's you want to see stuff, don't you? And especially the things is that I couldn't really film it when I was there, because I'd have a camera. When you're obviously online, it's a bit different recording. So it's just click a button. You don't need a filmographer. Anything else to add in regards to the advanced course? Anything else that you missed out or wanted to include at all? Or I think we did a pretty deep dive over everything.
Yeah, we have. As I say, it's similar, but it's different. Yes, you will need to know all the basic stuff first, but on the pre-course stuff, I have put I've put some identity work and videos and stuff up for people to have a refresher before they come on and do the advanced. So and all the 5 patterns of chronicity and all that's there. So
fabulous. Well, Sonia, thank you once again for your time today, and good luck. I don't know why I said that, but in courses, we're still in the middle. We're filming this at the beginning of February 2021, and we're still in the middle of this pandemic. So
Yeah.
are you planning to go back to doing in-person trainings, or do you think you're going to be just online?
I would like to. I really would like to, because it is a different dynamic, as we were discussing before, being
Yeah.
able to read people's body language, PSACs. I love physiological state accessing stuff. And so that is important, although it can be done through the screen, as you know, Matt, because you teach it as well.
Yeah.
So eventually one day, wouldn't it be lovely?
It
Eventually
would
one
be.
day, wouldn't it be lovely if us trainers all got to meet up and
Well,
discuss
we were
stuff?
going
That would
to
be really nice, wouldn't
we
it?
were going to do a summit, maybe the wrong word, but we were going.
Yeah.
There was going to be an
There was going to
IEMT
be one, and that all went
event
because of, yeah. So you never know.
in the good old days in
Yeah.
when you could meet people and do stuff. But
That's right.
but what I find quite interesting is just how effective doing IEMT with a client online is, because I've been doing it for a long time.
Oh yeah, I have for several years when it was
Yeah.
Skype, God forbid.
Yeah.
But
Telegram.
yeah.
Yeah. I think because everyone's kind of up their online game quite a lot, as in terms of equipment and headsets.
Exactly.
I always tell people, if you're going to be a practitioner or you're going to work with anybody online, spend a bit of money on.
Well, I'm looking at a proper broadcast camera. Okay. So, and I've got obviously proper mic setup. I've got my Blackmagic box, which enables me to change screens and do all sorts of things.
What are you doing that through? Is it through the name escapes me, but what software do you use to?
Don't ask me. Ask me.
Okay. All right. Okay. I know. It's just
the box is a Blackmagic box, and it's absolutely amazing for mixing audio and video, and it's just brilliant.
Is it web or is it Windows or Mac that you do it through?
Well, we are Mac people.
Right. Okay. Yeah. So I think
we wouldn't talk on our doorstep with Word. My husband wouldn't. He's very much a Mac person because he runs a software company. I'm quite lucky,
Fair enough. Yeah, no,
it will work on either. It will work on either.
Yeah, it's I've forgotten what the name is, but yeah, you can bring the different things in, because this is what I have is a very sort of cheap setup. Really, I've got like a Logitech, whatever it is, webcam. It's about.
But you've got a webcam, which is important. You've got a microphone, which is important, and it's rather than just trusting the screen.
Yeah, and the important thing is that it's the eye level. So when I'm doing anything to camera, you can see it's exactly at my eye level. Exactly. If I had my laptop, if I was using this through my laptop camera with it on my table, the quality's awful. Yeah. And especially if you don't have a microphone. So to get the best kind of control over a session, you really need to have, and this whole setup, the microphone and the webcam is less than £100.
Exactly.
So we're not talking, you've got a broadcast camera, which is nice, but it's not.
Depending on, the way you think about it, obviously in London, you can charge a lot more for sessions than we come up north.
Yeah.
It might just, that's one client's work.
Yeah, exactly. Yeah, absolutely. Yeah. So you want to, I talk about this a lot. You want to try and replicate clinical conditions as much as possible online. So and when we're kind of going off on different tangents here, but when you're working with people, make sure that the dogs are out the room and you haven't got any deliveries coming, and it's cool. Anyway, Sonia, I could talk to you for a long time, but it's starting to rain now and I need to do stuff.
I'll see you soon.
Cool. See you later. Take care. Bye.
Take care. Bye.